we can all improve our sexual performance and enjoy more or have healthier sex. In this video, we're going to see everything about how to enhance and improve erections and the musculature of the penis and vagina, so it's useful whether you're a man or a woman. But it's not for you if you're under 18 years old. I'm Dr. Milani Rubio, a urologist with over 10 years of experience specializing in sexual health. And the first step to improving an erection is understanding what happens during one, understanding the steps that occur in your body and everything that can negatively affect these steps. Let's see the steps and let's see how to enhance them, how to improve them. The physiology of an erection in both men and women. Yes, of course, women have an erection, which is the erection of the clitoris, can be broken down into the nervous system, activating the mechanisms linked to erection, blood reaching the area with your arteries dilating and filling the corpora cavernosa of the penis or clitoris, and third, that the blood doesn't leave so the erection is maintained. In many cases, this happens as a consequence of sexual stimulation, but it's not the only situation that can generate an erection. Your nervous system has many processes that you don't control, what we call the autonomic nervous system. The autonomic nervous system that activates us and helps us survive is what we call sympathetic. And the autonomic system that helps us sleep, digest, or reproduce is what we call parasympathetic, which also gives us erections. For an erection to happen, we need to inhibit the sympathetic system, prevent its activity, and stimulate the parasympathetic. This means that if you're nervous, with high levels of stress, sympathetic activity, and cortisol in your body, you're going to have a lot of difficulties having an erection. This happens super frequently in people who still don't have experience. It also means that if you consume substances that stimulate the sympathetic system, like some drugs or amphetamines, you're going to have a worse erection. When we have high levels of sympathetic activity, something that's increasingly common, unfortunately, we see it in two ways. Either we have low levels of sexual desire in the first instance, or we need more stimulation to obtain the same results in the same erection. Therefore, the first step we need for good erections and better sex, whether you're a man or a woman, is to inhibit the sympathetic system. For this, we can meditate, we can improve our sleep quality, we can use some method of vagus nerve activation as you saw in my previous videos. But the problem here is that most of us have such bad energy levels that when we inhibit the sympathetic and stimulate the parasympathetic at night, we're going to get sleepy, negatively impacting our sexual performance. This is the typical scenario of someone who finally relaxed after a long day of work and instead of desire feels tiredness and wants to go to bed. All this means that we have to improve our energy levels on one hand. On the other hand, we have to inhibit the sympathetic system, or be intelligent, and choose the time of day when we have the least sympathetic activity and the most energy. These moments are usually moments of more energy and less stress, and the correct timing, especially when your sexual desire or your partner's is not particularly high, is essential for good sexual performance and for good erections and good relationships. If we think about our circadian cycle, the ideal moments are in the afternoon when we still have energy, and especially on weekends if your stress level and sympathetic activity naturally falls on weekends. And in the morning if you don't have a routine that stresses you, because you simply take advantage of the parasympathetic activity that already exists and the erection that already exists. And if we talk about nighttime, and you usually have dinner and tend to be tired, plus at night, it's convenient to have sex before dinner. This is only what we can optimize about the sympathetic and parasympathetic system. There's much more, but in short, regarding this, the sympathetic system prevents erection and the parasympathetic stimulates it. But other nerves called somatic also stimulate erection. This is the reason we can have an erection of the penis or clitoris through more mental stimuli linked to the parasympathetic, or more physical ones linked to touch, that provides information to the brain thanks to the somatic nervous system, the nerves that allow you to feel that tactile information. And then we have blood flow. The activation of the parasympathetic system causes levels of something called intracellular calcium to reduce, and the smooth muscle of your arteries and corpora cavernosa to relax. This effect is not minor, blood flow to the area prior to erections increases 20 to 40 times in men and a bit less in women. Let's understand one basic thing. If the blood that reaches your corpora cavernosa is restricted because your blood vessels function poorly, because they're hardened by atherosclerosis and can't dilate, or for any other reason, 40 times more blood flow isn't going to reach the area. This means the erection will take longer to happen and will be less complete. And I feel obligated to explain that the corpora cavernosa adapt to the blood that arrives. If more arrives, they accommodate to grow more. How do we know how much blood should reach the penis or clitoris? Studies have already taken the trouble to measure this. A good erection generally implies that the corpora cavernosa have at least a pressure of 100 millimeters of mercury, a pressure you'd consider normal when taking someone's blood pressure. But in addition to the two corpora cavernosa, the penis has a corpus spongiosum that occupies the lower part where we have the urethra, and the corpus spongiosum handles a third of the pressure of the corpora cavernosa. That's why it's always softer. The increase in blood pressure in the penis or clitoris is essential because it's what gives the erection. It's what allows it to harden. You probably never thought that the urine you have in your bladder and the fecal matter you have in your rectum affect sex and affect your erections, but they do, and a lot. As you can see in an image of a pelvis, the rectum that accumulates fecal matter is located behind the prostate and the base of the penis. On one hand, this is going to affect your erections, you'll see how, and on the other, this is the reason why prostate massage in many animals, including humans, is done through the rectum. The bladder, on the other hand, is above the prostate. Both the bladder and rectum, when they're full, occupy more space than when they're empty, because they distend. And this is crucial data, because when you have an erection, blood needs to go to the penis area and stay there. The more blood that reaches the small space of your lower pelvis, the better your erection will be, and the more satisfactory it will be. The concept is simple, a limited space in your pelvis, because you have a full bladder or a fuller rectum, means more resistance for the arteries that reach those areas to carry the necessary blood. In constipation, for example, where the rectum is full of several days' worth of fecal matter and occupies much more space than it should, the rectum is pressing on those arteries that should carry blood to the penis. You'll have an erection anyway, but it will take longer to be complete or will require more stimulus to happen and to be maintained. Besides this, when the rectum is full, it makes it difficult to contract the muscles that support your erection. You'll see why these muscles are key to sustaining the erection long-term and to strengthening it. And you'll also understand how these muscles also influence vaginal contraction. For all this, the advice I give you is empty your bladder. It's much easier to empty your bladder completely if you urinate sitting down than standing. I'm not saying to do it everywhere, of course, but you can do it at home, especially if you feel there are still drops left in the urethra after urinating, or if you feel you didn't empty the bladder completely. Moving your hips forward and backward can help you eliminate those urine residues that may have remained. And the second advice, obviously, is to empty the rectum before having sex. For this, we can have a bowel movement beforehand. If you have difficulties having bowel movements regularly, the summary of what you have to do is eat more fiber. Insoluble fiber is a fiber that we can't digest and that our intestinal microorganisms can't either. Therefore, it functions as a sweep, as a cleaning system for your intestine, and also softens your fecal matter. Eliminate foods that tend to constipate more, as happens a lot with dairy. Use abdominal breathing that moves the diaphragm and helps generate more intestinal mobility. Elevate your knees when you have a bowel movement to maintain the ideal angle for going, which is as if we were squatting, and we can improve this by moving the trunk over the pelvis. But it's not a good idea to overcome constipation by just straining with your muscles, greatly increasing intra-abdominal pressure, because this ends in hemorrhoids and other pathologies. How do we use this information so it's not just information? First, we stay well hydrated to not decrease blood volume. Less volume makes it harder to maintain the necessary blood flow to the area. Second, We improve our aerobic capacity and our response to the increased blood flow demand that can improve our sexual performance. You can achieve this with high-intensity interval training, but not as intense as HIIT. We're talking here about sessions of 10 or 15 minutes of continuous exercise at high intensity, but they're longer periods with longer rests or simply longer training sessions where you fluctuate speed and intensity without stopping to rest. Third, you can avoid any increase in internal pressure that makes blood filling difficult, like gases, abdominal distension, fecal matter in rectum, or full bladder, as I mentioned before. And fourth, you can make sure you have all the conditions in place for relaxation of blood vessels to happen. For this, it's important to maintain good values of some minerals like magnesium, potassium, or zinc, and also good values of nitric oxide, which we'll see later. Why does all this matter? It makes sense if the penis or clitoris has some tool that maintains blood flow in the area. If you generate a traffic jam on the exit route so that more blood always arrives than leaves, this implies that your arteries dilate, but your veins compress in some way. That you slow down the speed at which blood returns to circulation, returns to your heart. How does that compression occur? When the corpora cavernosa of the penis or clitoris grow in size, the outermost part called tunica albuginea presses against the veins and compresses them. Therefore, the more the corpora cavernosa grow, the easier it is to retain blood in the area. But this is only half the story. The rest of the venous compression is done by two absolutely key muscles for your erection, and for quite a few other things that affect the quality of your sex: the ischiocavernosus muscle and the bulbocavernosus or bulbospongiosus. The ischiocavernosus is the most important muscle for your erection because the distal part, the part that reaches the base of the penis, compresses veins. It's that simple. The more strength this muscle has, the more tension it can generate, the easier it is for you to sustain the erection. Imagine the function of the ischiocavernosus like a band at the base of the penis that retains blood in the area because it's compressing it. And obviously we're going to see how to train it to improve your erections. But at the same time, the other muscle, the bulbocavernosus or bulbospongiosus, helps carry blood also to the spongy part, the lower part of the penis, and helps your erection to a lesser extent. But I also tell you that ancient anatomists called it the accelerator of urine and semen. It helps you compress the urethra to eliminate the final drops of urine so they don't remain in your urethra, and it also helps you eliminate semen. And there's something even more interesting, which is that in women, obviously, it doesn't fulfill the same functions. In women, the bulbocavernosus, due to its anatomy and location, serves to contract the vaginal entrance, which makes training it in women make even more sense than in men to improve performance and sexual satisfaction. Before seeing how to train these muscles, let's see if it's worth it for you, especially to do it. Although it's worth more for men than for women due to the amount of blood entering the penis compared to the clitoris, during stimulation and sex, an even greater contraction is generated than before of these two muscles I've been mentioning, which increases the amount of blood we retain in the corpus cavernosum. This allows the glands of the penis to harden and makes the pressure in the corpora cavernosa increase several times, being much higher than what you'd measure in your arteries when taking blood pressure. We call this the rigid erection phase. If the strength in these muscles isn't sufficient, if you don't have them sufficiently trained and strong, the last part of the erection will be harder for you, and you'll feel the glands much softer than the corpora cavernosa. The positive part is that this is easily compensable with exercises to improve erection. And the second element that tells us if we don't have sufficient strength in these muscles is the decrease in erection. If the erection loses intensity from physical exertion, and the physical exertion isn't extreme, or if it loses intensity in a short time without stimulating it, these are all parameters that these muscles should have greater muscle tone. Therefore, if any of this happens to you, you have even more reason to train them. What I recommend you do to train this is Kegel-type exercises initially. In these exercises, we seek to elevate the anus as if you were holding in gas, for example. We seek to do 3-second contractions, which seems easy, but if you've never trained them, You'll realize that you generate the contraction and then it loosens on its own, the anus descends, and you seek to do 3-second contractions, holding the muscle contraction and resting about 45 seconds. Do this exercise about 12 repetitions every day. Little by little, you'll gain more strength and you'll be able to increase the contraction time and go from 3 seconds to 5 seconds. In women, Kegel exercises can be trained in a much more optimal way, using objects with different weights, where the goal is to prevent the object from leaving the vagina, and progression is done using objects of increasingly greater weight. Training these muscles in both men and women results in more satisfying sex and better sexual performance for both. Second, there are other exercises for men called deer exercises, which is a type of exercise typical of Qigong that doesn't have the most evidence, but people who practice it report good results. I'll leave the instructions in the description in case you want to do it. And lastly, we have what has the most evidence, which are muscle training machines. These are the same machines that train your abs through the generation of electromagnetic fields that you've surely seen poor quality versions of in infomercials. But the real ones work and work very well, generating electromagnetic fields. And just as there are machines that serve to train your glutes or your abs with the same principles, there are machines that serve to train the pelvic floor, and each session of these equals thousands of Kegel repetitions. On the other hand, we don't need to have erectile dysfunction for it to be worth dedicating ourselves to seeing what the possible causes are. Knowing them and preventing them can prevent these types of problems from appearing. First, we have depression. Depression affects our erections because it affects our sexual desire, and because it affects the release of neurotransmitters that can give erection, but it's usually a more emotional than physiological cause. Second, we have alcohol consumption. A small amount of alcohol can improve our performance if we're stressed and have a lot of sympathetic activity because it reduces it. But using the right dose is very difficult, because if we overdo it, this prevents the release of neurotransmitters necessary for erection. The third element is obesity. Obesity worsens erections for many reasons. The first and most obvious reason it worsens is because of your cardiovascular health, and because it makes it difficult for sufficient blood to reach the pelvis and the corpora cavernosa. The fourth element is elevated cholesterol and atherosclerosis. These causes can cause hardening of the arterial wall, and when your arteries need to dilate to give you 20 to 40 times more blood, they simply don't have the flexibility to accommodate this flow. Fifth, we have nerve damage. The physiological processes your brain controls need nerves to happen, for the message to reach the area. If you damage the nerves in charge of this task, you won't be able to have an erection, or it will be difficult for you. This is often a consequence of some approaches to prostate cancer treatment. That's why they increasingly use new techniques that avoid or minimize the risks of damaging these pudendal nerves. And of course, for the same reason, prostate cancer can affect your erections with or without surgery involved. Seventh, we have antidepressant medications and other psychiatric treatment drugs, antihistamines, or even medications for alopecia like finasteride that can negatively affect erections. And then we have more causes like diabetes, low testosterone in both men and women, age, and muscle injury pathologies like myasthenia or multiple sclerosis. But a cause you've surely heard or experienced at some point if you're young is sexual performance anxiety, which is merely exaggerated sympathetic activation in men and happens the first few times. To solve this, all you need is to inhibit the sympathetic with the tools I mentioned before. Probably one of the most used drugs on the planet is sildenafil, and similar drugs used to stimulate erection. They are drugs that inhibit or prevent the action of what's called phosphodiesterase 5. What these drugs achieve is the dilation of arteries for longer and help you maintain elevated levels of cyclic GMP. Don't worry, you don't have to understand the mechanism. It's simply the physiological process through which we achieve erection. This drug, sildenafil, acts by helping more blood reach the area, but to elevate them even with sildenafil, you need sexual stimulation first. It's going to enhance it for you, but you need sexual stimulation anyway. This drug acts by helping more blood reach the area. So even so, it's useful for you to train the musculature of the ischio and bulbocavernosus to retain that same blood in its place. And the obvious advice regarding this is to optimize all the other tools first. Reduce your sympathetic activity and increase parasympathetic. Increase blood flow to the area with all the other tools you can. Train your musculature to retain blood in its place before using this type of drug, because probably doing everything else you won't need it. And the true messenger of your erection that generates vasodilation is nitric oxide, which causes that accumulation I mentioned before of cyclic GMP. Also, it's been relatively recently that we know nitric oxide acts as a neurotransmitter of erection. By common sense, we want to increase nitric oxide as much as possible before erection. In fact, many pathologies that can cause erectile dysfunction like hypertension are related to low levels of nitric oxide, and even erectile dysfunction can appear before the diagnosis of hypertension. We can increase nitric oxide and bring more blood to the area by eating foods rich in nitrates, like beets, celery, or spinach on one hand, and on the other. Since it's a molecule that's destroyed quite easily, quite quickly, we can use antioxidants like 500 milligrams of glutathione or 1 gram of vitamin C to avoid its accelerated destruction, because it's very sensitive to reactive oxygen species. At the supplementation level, we can use 1 gram of L-arginine, which is an essential amino acid, but despite it being its raw material, the ability to increase nitric oxide with arginine is mixed. The evidence is mixed. We have better results with the use of L-citrulline. Citrulline works better to increase arginine and nitric oxide because much of the arginine is destroyed as soon as we consume it before it can fulfill its effect, while citrulline is progressively transformed. And lastly, don't use mouthwash, because some of the beneficial bacteria in your mouth flora convert these nitrates you consumed into nitric oxide, which allows you to have results faster. Also, keep in mind that pornography-induced erectile dysfunction exists. This situation is quite logical if you think about it. It happens as a consequence of exposing ourselves to too much stimulus to many people, whenever we want and without effort. It progressively generates a desensitization of our reward on one hand. Basically, this means that afterward the real situation seems like little to you or doesn't motivate you. And on the other hand, it decreases the level of effort we're willing to make to have sex, because we can have satisfaction with less effort whenever we want. This desensitization affects your erections too, because it means you now need more stimulus at the brain level to get aroused, to generate the same level of parasympathetic stimulation. This happens in men and women, unfortunately, and the more frequent the use, the longer you've been using it, and the more serious the categories you consume, the more risk you have of this desensitization in real life. The test that can allow you to realize this, especially if you're a man, is the following. Compare the erection in a situation where you masturbate with your preferred adult content and on another occasion without using any type of content, not even fantasizing about that same content. Compare the time it took you to reach orgasm in both, and the quality of your erections in both. If the erection was more difficult the second time without adult content, you could have pornography-induced dysfunction. In that case, stop using it right now so your body can resensitize, and use products like a fleshlight that don't allow you to control hand pressure, generating a supraphysiological stimulation that later in the real act you're not going to have. One of the most important differences between men and women has to do with ejaculation and what happens afterward. In men, the erection ends and the detumescence phase begins. This period starts with the sympathetic discharge that occurs during ejaculation. Without that period, the erection could be prolonged for much longer. In ejaculation, there's a strong contraction of the bulbospongiosus, that muscle I mentioned before, every 0.8 seconds to help you eliminate semen. And then there's a relaxation phase of this muscle, and the ischiocavernosus as well. And one of the most frequent questions about the entire topic of sexual performance is whether there's a limit or an amount of sex that negatively impacts us. This is a question born from a Taoist concept that considered that ejaculating weakened our vital energy, and it's a concept we see again and again in different religions. We have examples of that in the Tao Te Ching, we have examples of that in Genesis and much more. Don't worry, I already took the trouble many years ago to follow those principles. I didn't gain any special qualities. I only had a worse time than I could have had. So the answer is no. There's no justification or evidence for semen retention. There's no amount of orgasm that can harm or weaken you, at least from a biological point of view. In fact, in general, people who ejaculate less have more risk of prostate cancer. One of the physiological explanations that justifies what I'm telling you regarding ejaculation is the following. If we ejaculate, we excrete sperm through a duct called the vas deferens, and we excrete the secretions from the prostate, seminal vesicle, and bulbourethral glands. But if we don't ejaculate and the sperm we produce in the testicle aren't excreted, they stay there. Nothing happens. They decompose and are reused by the cells of those same tissues. In fact, precisely because nothing happens is the reason vasectomy exists. Vasectomy is a surgery performed as a contraceptive method in men, and precisely in that surgery, the exit path of sperm to the semen is cut. It seems that nothing has changed in the semen, but that semen has no sperm. And that's why the surgery is a contraceptive method. And we arrive at a more controversial topic. But having taught anatomy classes and dissected bodies for so long, I have to tell you that what you call squirting, unfortunately, is only the involuntary emission of urine during sex. There's no gland capable of producing those amounts of liquid. I know it's not what you'd like to hear, and in studies done on these topics, yes, there are studies done on these topics, women's urine was analyzed, the content secreted during sex that they called squirting, and it was found that both had creatinine, urea, uric acid, and all the typical biochemical characteristics of urine. And ultrasounds prior to squirting showed a full bladder, and subsequent ones showed an empty bladder. Now you're going to ask me, are there other glands in the genitals that produce liquid? Yes, of course, but the largest are Bartholin's glands, or bulbovaginal glands, that only serve to maintain lubrication and produce minimal amounts of liquid, around 1 or 2 milliliters. And if they produce more, they do so progressively, not suddenly. To improve erections of the penis and clitoris and improve your sexual satisfaction, you need to reduce sympathetic activity, calm down, and be rested basically. Empty the rectum and bladder for better performance. Help blood flow by increasing your nitric oxide with diet, with supplements, or doing aerobic exercises that improve blood flow to the pelvis, and train the perineal muscles of the pelvis to keep blood where it should be. And lastly, if you have any cause of poor erections or poor performance, focus on it. And if you like this video, one way to support the channel is to subscribe and give it a like.